Okay. Good afternoon and welcome to what we hope will be the first of several Lunch and Learn events sponsored by the Community Equity Task Force. Our focus is to provide information on access to resources through the lens of equity. We want to take this opportunity to provide the community with this kind of information. This afternoon, we will have brief presentations from two individuals, Andrea Ruggiero from Open Doors Family Medical Center and from Kemi Pogue from Home Run Against Drugs. Their presentation will be followed by a short question and answer session. Stay tuned. Okay, Andrea, you are on.
Wonderful. Thank you so much, Robert. I'm, going to do a little brief sharing of my screen, so hopefully we will be able to do that. So let me just. Okay. Can you see my screen?
Yes.
Perfect. Wonderful. So just to provide you a little bit of background and a little bit of context about Open Door, we actually are a federally qualified health center. We've been around since 1972, and actually the first Open Door initiated in Ossining, and that's why we always feel so connected to the Ossining community. Since then, we have scaled our services across Westchester County and Putnam County, and most recently Ulster County. A lot of our work really expands across ages. We serve babies, we serve pregnant women, we serve every age you can imagine. And as you can see top left, Ossining Open Door. Everybody's very, very familiar with our facility. Obviously, we have grown tremendously over the years because our communities are asking for additional services. And I think part of what Open Door does very well is that we do listen and we do try to pivot and be responsive to our community's needs. And so here's, a brief overview of some of the programs that we have. Obviously, we have quite an extensive primary care focus. We provide comprehensive primary care services, gynecological, obstetrics, family planning. We, of course, provide dentistry services as well, behavioral health services that have been incredibly important, especially during this COVID era. We have vision services, and then, of course, we have an expansive number of enabling services, so supportive services that really are embedded into a lot of the work that we do around in Open Door. So we have a lot of preventative care that we really, want to make sure that our families know about. So, it's really, we don't want to be responsive to after people get sick. We want to work with them to make sure that we're preventing the onset of chronic conditions. So we do a lot of wellness programming. We do a lot of education around chronic conditions. We do a lot of case management and care coordination services. So if many of our patients are struggling with the healthcare system, which we know is incredibly complex, we want to have kind of a big group of folks who are able to provide additional support to our patients who are really having a hard time navigating the complex healthcare system. Of course, we have WIC services, and the program is really wonderful, and it is intended to serve all of our communities, regardless of whether they're patients of Open Doors. So we want to make sure that if someone is eligible for WIC, which is the Federal Supplemental Nutrition Program that helps women, infants, and children make sure that we have sufficient food available to them, then we really want to get them in. We want to make sure that our families have everything that they need to be supported. So this is just a brief patients at a glance. The majority of the patients that we serve, they do have some type of insurance. However, 44% of our patients are uninsured, and many of them are unable to get any type of insurance. So the whole point of a federally qualified health center is that we're supposed to be responsive to population health, community health, and making sure that everyone has access to healthcare, regardless of their ability to pay. So what that means is that if someone doesn't have insurance, we're not going to turn them away. We will bring them in. We will make sure that they receive the best services possible, regardless of that ability to pay. In even during 2020, we served nearly 60,000 patients. We were just talking about this last night. So what that means is that pre-COVID and then during COVID, we didn't really see a big change in that number, which means that people still needed these services. And it is really important. So federally qualified health centers were in the business of taking care of the community. So our patient demographics. So like I said, we serve approximately 60,000 patients. About 16,000 are children, so 17 years and younger. And the majority of them are below the 200% poverty, federal poverty level. So many of our patients who are coming into Open Door are, underserved. They really need additional support. Many of them have economic hardships, and Open Door does a lot of care coordination as far as making sure that we are assessing for additional needs and then referring to community partners. And I think one of the things that Open Door really does well is making sure that we are in the room with our community partners, making sure that if there is something that we can't do at Open Door, that we can rely on our community partners so that we're still strengthening our communities by working closely together. So another important piece of information is the majority of our patients actually identify as a minority, predominantly Hispanic or Latinx, and 71% are best served in a language other than English. And this is actually something really important to note because we receive a lot of our funding from HRSA, our federal funders. We're heavily regulated, and they make sure that we are responding to the needs of those individual communities. So if this is what our communities look like, and this is the community that we're serving within the context of Open Door, we want to make sure that our staff is culturally sensitive, culturally appropriate. We do a lot of training. We want to make sure that many of the staff are bilingual, many of them are bicultural, because a lot of our patients who are coming in are Hispanic and predominantly Spanish speaking. So we want to be able to provide appropriate care in the language that they are most comfortable with. So as I was mentioning, a lot of underserved communities, we have high-risk populations, and part of the high-risk populations is because many of our patients come in only when they're sick. So part of the work that we do is trying to get our patients not to come in just when they're sick, so that we can do preventative work, right? So come in yearly for your physicals, come in, get your medication regularly. If you're a diabetic, making sure that you're coming in regularly for your regular monitoring testing. And, we definitely partner with our patients a lot. So we have conversations about what works for them. And so access is actually really, really important, making sure that we're here early in the morning, late at night, on the weekends, when are our patients available so that we can be there for them, right? And we want to make sure that our patients also feel comfortable with what it is that they, need to contribute to their visits, right? So when you talk about payment, and I spoke a little bit about insurance. So because so many of our patients do not have insurance, we also have to institute certain elements to make sure that our patients are not scared to come in because they're going to get huge bills. We all know what it's like to get those explanation of benefits, and you have no idea what those things mean, and the insurance is paying 80% of it, and it's crazy. So we actually have to make sure that we have this thing called a sliding fee scale. And again, this is all very much regulated, both from HRSA, but also from New York State. And we have to bring this to our board of directors and have it approved every single time that the federal poverty guidelines are updated. So the sliding fee scale is representative of that federal poverty level. And we also have this element called the nominal fee. So if someone does not even meet the self-pay B, which is between 101 and 125% of the federal poverty level, then they would just be encouraged to pay a nominal fee, which is, it's a fragment of what the cost of the visit would be. But again, part of the reason why we have all of these pieces in place is because we don't want anybody to be afraid to come in and receive care. We also work with our patients to make sure that, listen, if your bill is, $100 and today you're only able to pay $20, that's okay. We'll put together, a payment plan for you. But next time you come in, you're not going to be told, well, you can't be seen because you still owe $80, right? So we work with our patients. We make sure that our patients are being as truthful as possible regarding their income. So part of this process is that, we do ask for proof of income. And if people, say that they don't have any proof of income, they get paid in cash, we have them sign an attestation, letting us know what it is that they make and how many people are in their household. So how many people are they supporting? We want to be as equitable as possible when it comes to this. So we really ask everyone to sign the attestation form, even if they have insurance, because the sliding fee scale actually even would impact someone with insurance, because if they have a very large copay and or they have out-of-pocket expenses, the sliding fee scale would still apply for that person. So that's a wonderful thing, that the sliding fee scale would be able to support anyone with very large out-of-pocket costs. So another really important thing that we do at Open Door is we assess for the social determinants of health, right? So when you come into Open Door and you're in the exam room, our medical assistant will come in there and they'll ask you several questions, and they're not to pry on your personal business, but it's to assess to see if there are additional supports that we can provide. And some of them might be related to, your housing status, or are you stably housed, or do you have, any issues getting food? And so we actually use this tool called the Prepare. It's an evidence-based tool. And some of the barriers that have come through for us, these are some of the most prevalent issues that our communities face. So transportation, housing, domestic violence, obviously stressors, health insurance, immigration status. And like I said, a lot of the work that we do is actually through the partnerships that we hold. So we try to do as much as we can at Open Door, but certainly we do rely on those partnerships. So during the pandemic, some of the big ticket items for us were obviously housing, food, and social isolation. So there was a lot of work that needed to be done. But what I saw was that there were so many of us who were getting together even weekly to talk about how do we respond to these issues and how do we do it in a coordinated way. So, as we kind of went through this whole pandemic, one of the big issues that we also saw is that we were trying to do a lot of telehealth, right? We wanted our patients who were most sick to come in for COVID testing or to be seen for their wellness visits. But everyone else we wanted to, do through telehealth. And what we saw is that lack of health literacy and lack of digital literacy were really, really big issues for us, right? So we needed to be responsive to the fact that many of our patients were struggling to understand how they needed to take care of themselves by having their phone conversation with their provider and not being able to see them. That was difficult to be able to say, I can't really read what the medication that I'm taking is, but this is what it looks like. We wanted to make sure that there were these very additional supports, these heightened supports. So we created a team of people who started working with our families to really help them understand, this is how you run, the video conversation with your provider, click on this button, do this, and we would kind of talk them through it. And they started to be able to do some of that connecting with their providers. And it was not an easy task to do, but we wanted to make sure that our patients felt that they were still connected to their providers. So like I said, digital health literacy was obviously very, very concerning. We wanted our patients to make sure that they knew what they needed to do when they were home to take care of themselves. But certainly there's a lot more that we're going to continue to do in this area. We know that there's still a very, very big need, even with all the work that we've done over the last, year and a half. So along those same lines, as we're doing a lot of the targeted outreach to many of our patients, especially during COVID, we needed to use what we call risk stratification for population health. So we were staying connected with our most high-risk patients, meaning if they were really ill, chronic conditions, if we knew that they were taking more than 3 medications, we wanted to make sure that they had their refills. We wanted to make sure that they were not going to fall out of care. So we needed to have a big team of people who were making phone calls and, making sure that those patients were coming in still to be seen in person as needed. So there's definitely a teamwork environment that needs to happen to make sure that all of our patients get taken care of. I wanted to provide just a quick brief update on where we are with our COVID testing, and then of course our COVID vaccines. So I had this slide made last week, but we did get more updated numbers. So as of July 19th through the 25th, there were 338 COVID tests that were conducted, and our COVID finding rate was 1.9%, which was that number almost doubled since the last report out, which was 2 weeks ago. So we do see that little bit of an increase, and we're monitoring that very, very closely. We did administer 669 COVID vaccines. This is for patients 12 and over, and 28% of our patients have been vaccinated to date. So 28% is very low. We feel that it is low. This is something that we are looking into because we are looking both at NICES, which is where all of the vaccines get documented, and we are also looking internally to see, asking patients, did you already get your vaccine somewhere else? Some patients say, yes, I got it through my local CVS, and we're documenting that as, yes, patient reported that they got their vaccine. So that 28% is mildly, disappointing. And we're still working on that. So some of the information that we're obviously getting out there is that, vaccines are safe. We're working very closely with our, Department of Health. We're working very closely with, CDC officials to make sure that, in fact, the vaccines are available to anyone who wants them. We are developing almost like an outreach team that's going to go out there in the field to try to get people to come in and also for us to answer any questions about the COVID vaccine, to make it as easy as possible to get the COVID vaccine. Of course, we know it's free, so we want people to know that we want to administer that vaccine. We really want to get it in there. But we do know that there's a lot of vaccine hesitancy, which, it's not as bad, obviously, in New York. And certainly when I kind of dug in a little bit further, there's not a lot of vaccine hesitancy being reported in our general area. However, as you can see, only 28% of our patients have been vaccinated. So, it's not what we want to see. We're doing a lot of work, again, to answer questions around vaccines. We know that there have been some general questions about safety and also whether vaccines impact someone's ability to have children in the future. And I think those are the big questions for parents, especially. If my 15-year-old gets vaccinated now, will this impact their ability to have children in the future? And there has been absolutely no evidence of this being a side effect or an issue regarding fertility. And also regarding GBS, this syndrome that has been linked to the Johnson & Johnson vaccine. Again, based on the numbers of vaccines that have been administered, there's just no causal, link between J&J and GBS, but what we are doing is obviously we're providing a lot of information regarding if you have these symptoms, please contact your doctor, come and see us. We want to make sure that there are no adverse effects after any of the vaccines. And we make sure that anybody who gets vaccinated waits in the either in the exam room or in the waiting area for at least 10 to 15 minutes to make sure that there are no adverse side effects after they get vaccinated. And just some, brief overview on the vaccine in children. We definitely are seeing a lot of great work being done through the school-based health center program as far as, educating our families, the safety and making sure that our families feel comfortable with administering the vaccine. What we've been, instructed to make sure that we're sharing is that COVID-19, while many of the kids recover very, very well, there's still, an adverse impact if they do get COVID-19 and then come home and bring it to someone who is not vaccinated. So even though they might be okay, someone else in the home might not be okay. So it is really important that we get this information out there. And I did include a little bit on here about the myocarditis, because this is something that I know many families are asking about. And so we have not seen any of these cases locally. However, we do understand that there is this fear that this could be something that could affect their children, but we have not seen any of this. And the CDC is still recommending it for 12 and over, and they feel very strongly that the number of these adverse cases is based on the number of vaccines administered, we should move forward. And just, I included a little bit of information, obviously, on adolescents and young kids, hospitalizations, and the number of cases that, we've seen definitely a spike in the number of cases affecting adolescents. We're monitoring these numbers very, very closely. These are nationwide. These are not, New York specific. But we do want to make sure that we're just keeping a very close eye. We're very lucky that in New York, our numbers are still somewhat on the lower side, but we are keeping a very close eye on this. This is just a brief report out on the estimated number of cases of COVID-19 in children. About 3.9 million cases, 38,000 hospitalizations, 300 deaths, but we think that those are undercounted. And again, deaths from COVID-19 similar in numbers to the deaths from flu and varicella and measles. So, we do want to make sure that we are, monitoring all of this information. So these are ways to get in touch with us at Open Door. Of course, our general number, 914-OD-CARES, 914-632-2737. Of course, we have our patient portal. We have a patient portal support line. We have an email address in case our phones are busy, because sometimes that does happen. There are times when we get 800 to 1,000 calls a day. So please feel free to email us if you can't get through on the phone. And then, of course, feel free to visit our website. We have a lot of really great information out there and a lot of important updates that we try to get as quickly up there as possible. So, thanks.
Thank you so much, Andrea, for that information. So now we're going to turn the floor over to Kemi Pogue, who's going to give us some information on her organization. Okay, Kemi, you're on.
Hi, everyone. How are you?
Good.
So I'm kind of representing two organizations. During the COVID-19, I was the director of the Austin CAP, which is an organization that helps families in need in Austin. I'm so sorry. We have a lot of background noise here. But we have helped several families in partnership with the town and the village, who has partnered with other organizations. So it was a team. Teamwork makes the dream work. So, but Open Door really gave an overview of what was going on. A lot of the clients of the Austin CAP are patients there at Open Door, and Open Door was definitely at the forefront. But we'd helped families, over 500 families during the COVID. There was a lot of families who needed help with rent, with simple things as masks. Food insecurity was very, very high. We had food distributions. The community came together and addressed a lot of those issues. A lot of the youth did not have Wi-Fi at home, so they had came into to our office and used the Wi-Fi to go to school because it was remote. So we were able to address those issues. And again, with partnerships, I mean, that was really what helped the community. You know, during the COVID, everyone came together. It was all hands on deck. And, you know, thank you, Dana, and the town of Austin, you know, with the hand sanitizers and the mask. You know, thank you, Althema, for volunteering, coming in, and, you know, whatever we needed, you helped, you know, people with their situations with their landlords. So I appreciate that. But I don't have a presentation. You know, if anyone has any questions, I can answer questions. But it was a community effort. It was a community effort that addressed a lot of the issues that arose due to COVID-19. So,
Kemi, could you just give us a little bit of a background on the second organization that you're representing, which is the Home Run Against Drugs, and sort of what's the purpose, what you guys are doing, how people can access the resources or services that you provide?
okay, great. So Hit a Home Run Against Drugs is a nonprofit organization that was formed in 2018. But the work was being done years before that. But it's an organization that helps youth with developmental aspects of their life. So that's behavioral, academically, mentally, socially. So we address all those issues as a whole child, and the whole child includes the family. So we have a mentoring program that the kids love. We partnered with New York State for their mentoring program. So we have Mentoring Mondays, which is on Zoom. And then for the summer, we had took a break, but we're going to start back in September. We have Tutoring Tuesdays and Thursdays, where there is a peer-to-peer tutoring. So we have some high school kids tutoring the students in younger grades. And then we also have certified tutors that have partnered with some youth in our organization. We have a summer camp right now that is pumping and the kids love it. And that's where I'm at now in the office. So that's the background noise that you hear. But it has helped a lot of youth have a great summer. Okay, hold on one second. Okay, sorry. Yes, you can.
Can I have this?
Yes, that's fried chicken. Sorry. We're distributing lunches, and then the library is coming. So they'll be on their way because the students are doing their summer reading. So that's great. And then there's a lot of youth. We have 43 youth that are registered from kindergarten to 8th grade. And a little bit more than half do not have a library card. So the library is going to come in, one representative from the children's and from the teens, and they're going to talk to kids about the summer reading, how to document their reading and the prizes that they can get, the importance of reading. And then we're going to sign them up to get a library card, and we're going to take a trip down to the library so they can get a tour. But we have a lot of youth that wouldn't have been doing anything for the summer. And it's an enrichment program, so they're having fun, but we do incorporate the enrichment activities, STEAM, the reading, academic support. So it's a range of great activities for the kids to participate in the summer. This spring we became a certified school-age program through New York State, the OCFS. So that was great. So we'll be able to offer students an after-school program. We also have other programs like the Environmental Club, which I'm very, very excited about. And again, thank you, Dana. You have been instrumental in bringing that to life. So I thank you and Green Osling and everyone that helped put this together, Dana White. So it's a lot of the community came together, right? So they have done great activities and participated with weekly activities through the Earth Day festivities and everything. And then we have just so many different, we have so many programs. We're excited. Althema, thank you, her, Lindsay, everyone has been all hands on deck, volunteering at the summer camp, participating in the different activities. So the community has just been very, very supportive. And then we also have the parent component as well, which is ran by OPAC President Charlotte Sakuru. So she has activities for the parents and educational opportunities for the parents to participate in as well. And there's so much more I could, but I here with the camp and, but if anyone has any questions, I can answer them.
You're muted, Sandy.
Sorry. Okay. All right. How can people get in touch with your organizations?
So with the Osling Camp, I am no longer the director of, but I still help. So you can come to 81 Croton Avenue on the second floor and speak to Myrna Masquetta. She is the community advocate. If you need to talk to me about anything or need assistance, you can reach out to me as well. But I do still help there at the Osling Camp. They're actually implementing a workforce development series there. So that's great. So if you're looking for a job or you need skills to get another job, come on down to the Osling Camp. We're here to serve you. And then for the Home and Against Drugs, Rising Above Boundaries program, you can give me a call, 914-236-8595, or you could just come and stop by, 81 Croton Avenue, 3rd floor.
Awesome.
Okay, thank you so much for that information. So now we will, unless anyone else have anything that they want to add to the presentation, we'll open the floor up for questions.
So we have some attendees, or attendee, I should say. And if you do have any questions and you want to just put them in the Q&A, because the person who's able to make you part of the panelists, since there's just one person, we could just make you part of the panelists. I think she might be on another call. So, Maddie, if you have any questions that for any of the panelists and you want to put them in the Q&A, we can just ask that. I actually have a couple of thoughts that I wouldn't mind sharing. But if anybody else wants to go first, feel free. Okay,
Go right ahead.
I can go ahead. So I was, I think that study, Andrea, that Open Door did that highlighted some of the barriers to care was really interesting, especially for our equity task force and for us thinking about, again, what are the the whole idea of this Lunch and Learn is to think about what our many partners on the task force or services and resources that are already being provided, but looking at what are the barriers, especially for people of color. So one of the things you highlighted was transportation and also digital literacy and health literacy. Mm-hmm. So I'm just going to say the four things that were on my mind before, because otherwise I'll forget them. And then the other thing was about the vaccination hesitancy and your low 28%. I mean, that just seems incredibly scarily low to me when
Yeah.
we're looking at what the percentages are either around the county or around the state. They're so much higher, we're looking at 68, 70, 71 or 2% of people being vaccinated. So what does it make? Why is it so low in your population? So I'm curious if you have any more information about that. One of the things that I've been thinking about, just because, among our own staff, we have vaccine hesitancy, and it seems to me like one of the fear factors that I've been hearing, and this may be different among different groups, is the fear of, because it's not FDA approved yet. It's not really, it hasn't gone through all the testing that needs to be done, and therefore it's risky. I don't know if any vaccine has ever rolled out to as many people as this has. So I'm curious about if you can illuminate us on any of that. But I would also love to see a comparison chart with, if you don't get vaccinated, the likelihood, the percentage likelihood that you're going to get sick and very sick versus the percentage likelihood, if you do get vaccinated, that you will get sick and very sick. And I don't know if anybody looked at it quite like that, because I think that would be really interesting to see those statistics against one another, So anyway, I'd love for you to talk about that, and then we can go back to talk about digital literacy, health literacy, and transportation, because I wanted to just mention a couple things that I know the Village and Town have been working on.
Do you want me to start with vaccine hesitancy first? Let's start there. So, what's really interesting is that we've been having a lot of internal conversations with our, clinical leadership and other folks to try to understand exactly where this is all, how could it be that we have 28%, we've done so much to make sure we get people in, and we're not where we want to be. And Lindsay is certainly very frustrated as well. And we are really kind of trying to figure out different ways of getting to our patients and, helping our communities understand why this is important, right? We do think that there is a lot of misinformation out there, which I think is part of the problem. And a lot of the conversations that we're having with many patients who are refusing the vaccine, some of it is fear. And so they're saying things like, well, no, I don't want to get vaccinated because I want to get pregnant in the future. And I'm not, so young women, especially young women of color, they're afraid to get vaccinated because this is a thing that they're hearing. We've even heard things about, oh no, it goes against my religion. I can't put something like that in my body. So we hear a lot of information, and we want to be as sensitive as possible, but at the same time, we want to encourage the vaccines, because we do feel that they are making a difference and they are keeping us healthier. The comparisons are a little bit more difficult to make in the sense of, it's hard to know how the actual illness will affect an individual, right? We saw that people of color were most dramatically impacted by COVID, right? We saw so many different side effects and conditions. We still have patients who have not gotten their taste buds back, and they had, COVID back in January and December of last year. And we see that. And, there's just not enough information to really know whether someone is just going to get, some mild symptoms and, 10 days later, they'll feel great. There's not enough information out there, which is unfortunate. And I think we're all learning. And I think part of the fear is because things change so quickly, and they can change from one day to the next, right? So as much as we want to say, this is the final word, we know that this is all good, by tomorrow, we might have something that's a little bit different. And that's scary, right? It is scary that we're not used to that. We're used to saying, this medication works and it does what it's supposed to do, and it'll keep you healthy. And what's happened is that with COVID, things were changing so quickly. Remember back in March 2020, we didn't have enough COVID tests. And so we could only test people who were symptomatic, and we could only test people who were very, very high risk. Those were the only people that we were able to test. Then slowly but surely it was, we had a lot more COVID tests available so we could test more people. But the information was evolving and changing so quickly that people started to lose trust in the information that was being presented to them. And I think that's a big component as to why there is so much mistrust, is because today we're telling someone this information, and then tomorrow some of that information might shift a little bit, and that is scary, and I understand that. And I think that's part of what we're trying to help our patients see, is that we understand that there probably might be additional information forthcoming, but these vaccines are safe. And in fact, there were studies being done on other types of vaccines that we were able to learn from, and then be able to expedite the development of this vaccine. So it wasn't that the COVID vaccine evolved overnight, which is part of our conversations. We have these conversations with our communities all the time to say, yes, you're right, it did happen very quickly, but it wasn't because we were specifically looking for a COVID vaccine. It's because we were experimenting on other types of viruses and other types of vaccines. They were already in development. And then there was a ton of money that was thrown at these scientists and these chemists, and they all they did was do this. They were only focusing on the development of this COVID vaccine. And so there were a lot of resources that were put into making this a better, a stronger effort to make sure that we kept our community safe.
Right.
But it is, I get it. I get it.
Is there anything that you have found to be effective? And is there any way that, as a task force with many different organizations and reach in, throughout our community, that are different partners, and, like Kemi said, teamwork makes the dream work. Like if we can help, with Patients of Open Door and Ossining, certainly, to utilize any tools that you have found successful. And also, I'm not 100% sure if you're offering all the different types of vaccines right now at Open Door. I know that OVAC does also have those available for, I'm pretty sure you can walk in to the Ossining Volunteer Ambulance Corps. Yeah. I'm guessing Open Door now does too, where you can just walk in and.
Absolutely. We will, we're making it as easy as possible, which I think, is very important to making this happen. And actually, so we're going to have a couple of outreach people who are going to be literally like going into the various, delis and, hanging out in the community, being like, hey, we work for Open Door. Have you gotten your vaccine? No, let me walk you over. We're getting to the point where we will make it so easy. Like, I'll walk you right in and get you a vaccine that quickly. Because we don't want people to be afraid to come in or to feel like, well, I don't want to wait on the line to get an appointment. We want to make it as easy as possible, because some of the feedback is also like, I just don't have time. I don't have time. I don't want to wait. There might be, I have to sit there for an hour to get the vaccine. Like, I don't want to deal with that. People are busy. They have things going on. So we want to make it as easy as possible. We are actually also working to develop some strategies around incentives. I was just listening on the news that now in the city, you get $100 if you go and get your vaccine. We're probably not going to do $100, but we'll come up with some incentives to motivate people to come in and get vaccinated. We certainly look to you, and like I said, without our partnerships, without the support from the Ossining Village and from the support of everyone, we wouldn't be able to do everything that we do, right? Like, we were able to do a lot of information sharing through all of you when we were doing COVID testing, when we were doing the vaccine rollout. So certainly around vaccine hesitancy, we will need your partnerships, because as soon as we have these folks ready to go, like outreach strategies out in the field, like, we'd love for you to talk to everyone and say like, oh, Open Doors deploying staff to go out and talk to people and answer questions about the vaccine and help bring people into the center without having to wait for an appointment or have to wait in the waiting areas. Like, get people in as quickly as possible. Right. So I think we'll want to certainly get that information out there so that people are not like, what is Open Door doing? Like, and part of it is because we do want to be able to answer those questions without people having to go on the website or have to go visit the CDC website. And,
Right.
we just want to be able to be like sources of information
Right.
and to have the most relevant and current information, because like I said before, information is forthcoming every single day.
Right.
That we want to make sure that we are being as transparent as possible with the information that is available to us.
Right.
So,
So-
Andrea,
Yes.
I just want to, there's a question in the Q&A box from one of the participants, and she just wanted to know a clarification. You indicated that 60,000 patients were served. Was it in 2019, and was that across all open
All of
doors?
our sites, yes, all of our sites. So not just Ossining. So, it was very interesting. So we expected 2020 to be obviously like most other organizations to sort of be a bust, right? It was COVID 24/7, and we just were, just like everyone.
Mhm.
And every year we have to report the number of patients that we serve to the federal government. So every year we have expansive reporting mechanisms to be able to make sure that we capture all of this data. And we looked at our 2019 numbers, and we served, I think we were short like 20 patients to get to 60,000 patients. And last year it was the same. We were off by 30 patients to get to that 60,000 patient count, which is amazing to have seen that many patients. And if, we were only counting patients who had not just had COVID tests. We're not talking about like new patients to the organization who were seen once for a COVID test. We're talking about established patients who received primary care through Open Door.
Mhm.
So what's impressive is that whether it was through telehealth or whether it was in person, patients still trusted us to be able to come in and get taken care of, it was so telling about how important the services are and how important it is for us to continue to provide the care that we provide. Because, I was nervous. I was nervous to go get a physical, right? I mean, most of us were probably like putting things off. And so many of our patients still came in and got taken care of. And I was so happy to see that, it was great.
Thank you.
Of course. Now, I know you had a question about transportation too, and I did want to briefly just answer that question. So Ossining, the thing is that we're great because we're central, right, in Ossining. So a lot of our patients either walk or take taxis, or, they'll take the train in and then walk up the hill. The transportation issue mostly applies to when we're making referrals to a specialist, for example, right? So let's say that a patient has a finding in a breast exam, and we need to refer them over to get some additional imaging or additional, testing done. Patients have a hard time getting to other facilities. That's an issue that we have found over and over again. So part of what we try to do at Open Door is actually either do fundraising, or we identify grants to help support some of those needs, so that patients who just don't have the ability to get to those specialists will help to transport them there. So that's part of, how we respond to that transportation need, but we know it's an ongoing concern, and it's not just here in Ossining, it's in all of our communities. We see that across the board.
So I just wanted to say that, one of the things that the village and town have been working on is looking at different types of transportation options to help, whether it's like, electric pedal assist bike share programs or electric scooters, or also there are van pools and other types of services like that. And 511 New York Rideshare has been helping us a lot to coordinate those, and look into what kinds of things we can do. And knowing that Open Door, might have that as an identified need, might be another avenue to partnership to make it easier for us to offer those services in general for people in Ossining, but also, for example, the bike share program that we were looking at is something that's supposed to cross boundaries and go into other municipalities. So we're looking across municipalities, and what you're saying now sounds like it maybe would kind of align with some of the things that we're looking into. So I think that it would behoove us to speak about that, offline, so that we can look at synergies for to meet your needs as well as the rest of the community needs.
Absolutely.
And then I know that I mentioned also digital and same kind of thing where there might be some things that Village and Town are working on. In fact, I just got an email right before this meeting about this grant, I think that I had mentioned in other task force meetings that we've applied to for free Wi-Fi in the parks, for example. So things like that, where we think that there might be an opportunity to partner for grants or improving access to resources, where Open Doors identified specific needs where their clients, your patients aren't able to access care, I think is a great way for us to tackle some of the bigger problems that we see, throughout our community.
Absolutely.
So just a thought. And then for Kemi, I was wondering, Kemi, if you're also in your program have identified vaccine hesitancy. Are you seeing that that younger people who are eligible for the vaccine are getting the vaccine, or are you seeing any ways that we can also help, from community perspective or from the task force perspective to help, especially as we're seeing, these mandates start going into place now, at the state level for workers and things like that.
I think it would be a great idea and I was going to bring this up to you, is for the task force to have like maybe a Zoom that parents can attend. Maybe have Open Door there and speak about the importance of getting vaccinated. I don't push it on anybody because everyone has their own reasons. But I know that the youth here, there's 4 kids that work here that have gotten the vaccine.
That have not. Did you say that have or have not?
That they have.
They have gotten it. And there's more that are eligible, but not everybody has gotten it.
Yes.
So that sounds like a good idea and something that we should follow up with.
I agree.
What about the possibility of asking, and maybe just in a private way, and I don't know if this is something that we could do, is what are your hesitancies? And, maybe if it's, sending it anonymously and seeing what they are and trying to answer those questions. I think a lot of times the commercials speak to one thing. A lot of times I haven't really seen anyone answer some of the hesitancies that people may have specifically. It's always, I'll get back to you. And I think sometimes that I'm back to you is the unreadiness that people have. So maybe if there was a time frame to get some of these questions that are, providing the hesitancy and getting the answers for them, that could be, because maybe it is the autoimmune population, it's a population with diabetes, it's certain populations that have these questions and they're kind of sitting in limbo. They want to answer and they're just kind of waiting. Because I think right now there's a push. It's like hesitancy versus anti-vaxxers. And I think that everyone is getting lumped into that anti-vaxxer community. And that's not true. Some people are scared and they're hesitant. They're not anti-vaxxers. They just want to make sure that they're making the right decision and, later on down the line. And I don't see a lot of things that speak to the hesitancy of people. It's just like, oh, you're anti-vaccine. And I don't think that that's true for everyone.
Althema, how do you think we reach the people that then we ask the question to? How do we, what would be a way for us as a task force to reach people, to get them to share with us their hesitancies?
I think maybe, just something anonymous, even how we've been doing our surveys, just send the email here. We're not going to capture your data. We just want to know your hesitancy, and we want to be able to get you an answer that could, really shape your decision. Because I mean, even from in my line of work, you know, I do contact tracing
Mhm.
and investigations, and we do get people who ask questions, and they're hesitancy questions. They're not necessarily anti-vaxxers. They're just scared
Mhm.
of things that they've seen and they've heard. Like I like the slide where you talked about the Johnson and Johnson and what happened, and that, you know, I think that people should know that it's only 100. I mean, they were transparent with it, but you know, just kind of being transparent of things and allowing people to be scared and ask the questions that's going to put them at ease to take the vaccine.
That's such a good point, you know, and I'm hoping that we will get some of that information too once we get some folks out there to talk to the community, right? Just answer
Right.
questions, dispel some myths. And maybe, you know, part of what their role should be is just ask some questions like, oh, if you haven't gotten vaccinated, may I ask, you know, if there's anything that I can do, answer some questions, you know, do you have any questions about the vaccine? And you're right, maybe people will just tell you, well, I'm just nervous about it. Maybe there wasn't enough time to develop a proper vaccine. I don't want to get sick in the future. Maybe they have some fear around the vaccine, which is understandable. And I have to tell you, there was, you know, there were a lot of folks who thought that once they got COVID, they didn't have to get the vaccine anymore because they already had the antibodies, right? And this wasn't just like, I mean, this was for a while, this information was out there, right? Because that's the information that we received at the beginning. When the vaccine, when we didn't have enough vaccine, what we were being told is, okay, you know, these antibodies will essentially hold you over for a little while, right? You'll be okay. But as soon as we had enough vaccine, we were told, okay, as soon as someone is better after they've had COVID, so after 10, 14 days, depending when they're symptom free, bring them in, get them the vaccine. You don't have to wait. We don't want them to wait. So again, part of it is that because the information evolves, sometimes people heard the last bit of information, which was once you have the antibodies, you're good, you're fine, you'll be okay.
Andrea and Kemi, I just have one last question for Andrea and Kemi. For summer programs that are still in force, do you think it would benefit, like Andrea, you're saying you're going to send people out into the community. Could it out into the community be the Kemi's program when parents are coming for pickup or something like that?
100%.
Drop off, and you know, people could get questions answered. And I was thinking like that. I know Horak has a couple of summer camps as well, and then maybe some of the other camps would be interested, or you know, the rec programs could have you know, a doctor or somebody there to answer questions.
Love it. All over it.
Because I think that's the only way that you're going to really begin to answer people's hesitancy questions. It's got to be a one-on-one. You know, putting something out on the internet or in print is okay, but it still doesn't, it may not address the individual's specific question. But if they're talking to somebody one-on-one, then they can say to them, well, this is the thing that really has me stumped. You know, what do I do in this kind of a situation? So it would be wonderful if we could sort of pull something together to do
Yeah,
that.
I was thinking, I mean, Jermaine was just on here. He hopped off, but I know he has a big NU event this weekend at Nelson Park. And it would be great if somebody was just at Nelson Park who could just, I mean, and I don't know if he has vaccines, but even if they're just somebody there answering questions, you know, obviously it would be great to have vaccines there too, but you know, if not, it would be great to have people, somebody there who could just answer questions if people were hesitant and wanted to just get answers, you know, in a non-binding or non-threatening kind of a way, you know, where it's just like
information. It's information.
Info. Yeah.
Love it.
And I think that's great. I mean, I could ask Jermaine, we speak all the time. I could ask him about it. And I'm sure that he would be open to having, you know, someone there from Open Door that can answer those questions.
Yeah, I'll definitely get the information back. We're, you know, they're in the process of hiring these folks, so I don't know that they have them quite yet, but I would, you know, I would love to stay in touch and make sure that, you know, we are, as soon as these folks come on board, that we are able to partner around getting them to these various events, these these things, these forums will be incredibly important for us to really connect with our communities.
Yeah, so, and then Maddie, is Maddie still on? Yeah, Maddie, I think you were still on. So I don't know, I'm just thinking maybe, we could also just talk to Bill Garrison to see if he has any time, pickup times or whatever left in the next couple of weeks before camp's out, that maybe we can talk to Open Door to get somebody there,
Love it. Sounds great.
So it's a little bit after 1, and our goal was to make this 1 hour. I want to thank you so much, Andrea, and thank you so much, Kemi. The information that was provided is very, very valuable. And we're so grateful and thankful that you decided to participate on this Lunch and Learn.
It was my pleasure. Thank you all.
Thank you. Everybody have a good rest of the day.
You too.
Take care.
Thanks
Have a
so
good day.
much, everybody. Thank you.
Thank you.